Welcome to the Wealthy Dentist Podcast, where we explore how top dentists are building incredible businesses. I'm your host, Ward Powell. Let's dive in. Glad to have you here. I'm so happy that you've been able to spend the time with us. I just wanted to, basically find out what got you started into the dentist industry.
Well, it was not something that I grew up with. And in fact, I'd only had a couple of dentist appointments by probably my last year of college. I didn't even know what dentists really did. My brother had gone through a bunch of supernumerary teeth, so I knew he'd gone through a lot. But for me, I was just sort of looking for something to do. And so therefore, when someone says, "Can you talk to my son and daughter to get them together?" I say I'm not the right person because I didn't start college thinking about being a dentist. I had no role models that were dentists. And it was only when, and if you've ever been a parent, you know this, when your son or daughter comes home from college and says, "I don't really know what I want to be anymore." That's what happened to me. And my mother said, "Go down and visit our local dentist. He just got back from military. He's a great guy." And that changed everything.
Awesome.
Dental school. Again, starting dental school, I didn't know what dentists did. I knew they had something to do with teeth. And but basically, I found my niche. I almost went to medical school my sophomore year of dental school. Very close, really, really close. Because I was working in a hospital as a phlebotomist to put myself through dental school. But I don't know. I think what I saw was the life of the physicians. And even back then, I thought it was probably chaos and probably not as independent as I would like to be. I began to get some mentors in dental school at the University of Texas at Houston, and that was it. I knew that I loved general dentistry, and I still do. But for whatever reason, something guided me towards either oral surgery or periodontics. Maybe that was because, to a certain degree, I'd always thought about medicine. And those are the two closest things I could find to it. And therefore, I had applications for both programs. I did very well in dental school. I learned my lessons, belonging to a fraternity in college. So I didn't repeat those things. But I got good work habits, much more mature, and I probably could have gotten in either program. But for some reason, I love patients. And oral surgery is more prescriptive. And therefore, I was able to do the surgery while at the same time enjoy patients, plus in the same time also integrate medicine. And there's no other specialty that integrates medicine more into its specialty than periodontics.
Yeah, I'm getting a bit of that work done myself right now. So I understand. So what would you find was your most challenging moment as you moved through dental school and then you shifted over to actually getting yourself involved with the industry as a professional?
Well, I think the thing is we're always trying to find ourselves. My plan was to go into practice in Houston. I already had an excellent offer, a really, really good offer, because I worked for this periodontist on the weekends while I was in graduate school. And I also had a private practice on the side too that I worked on in the evenings. But I made a decision. I know I taught high school biology before I went to dental school, just to show you just how many things I was looking at. Of course, I knew after 1 year that I wasn't planning on doing that. That was a fact. There was no money. My parents were teachers and I loved it, but there was no money in it.
Right.
And I mean, kids have always been difficult. So
Oh.
so from that, I, for a couple of reasons, but I landed at a new dental school, well, somewhat new in Florida.
Hmm.
And when you go into something new, you can help call the shots versus traditional dental schools where it's very difficult to change anything.
Mm.
And I landed in Florida. It was the only school then in Florida. Bunch of new, aggressive faculty, young, wanting to make changes.
Mm.
And I found my niche. I mean, I love Texas. I was just there speaking, but Florida is an incredibly fantastic state, diverse. Um, you know, there's just so many positives to it that I just never left. My parents eventually joined me. My family joined me in Florida from Southeast Texas. But I think the challenging it for me is always, especially now, is the volatility of our profession. Um,
Yeah.
it wasn't when I started, 3 decades ago. It was definitely more amorphous. It was not heterogeneous as it is now. To just date myself, if you ever thought about going into some kind of DSO or even taking dental insurance, you were looked at as, what's going on here? Fee for service, private practice, general dentists are your classic model of what dentistry was about.
Mm.
You were able to be successful, with the exception of some areas when we've had some recessions or what have you. But dentistry has always been extremely successful. However, now it's when I interview a dentist or what have you, I need a background because I never know. Only 30% of dentists right now are in a solo practice. 70% aren't.
Yes.
My
So
goodness, has that changed?
yes.
So I think the challenges for us is trying to find your niche while at the same time providing a income. I mean, you have to think about that. I mean, that is the name of your podcast.
Absolutely. Absolutely. Yeah, when you can see where things I have gotten a bit I don't know, for lack of a term, I just bare in that in the space of having your independent practice with with this particular in this particular industry with the DSOs that you just mentioned, pretty much in venture capitalists taking, you know, the helm, the headway, if you will, on the dental practice. And that is a challenge. And is that something that you see that's going to I don't know, totally take the dentist industry as you knew it out of where it could be in the future?
Well, it's a very, very insightful question in that we believe that there will always be McDonald's and there'll always be Ruth Chris. More people are going to go to McDonald's for various reasons. Less people go to Ruth Chris.
Mm.
I am very influenced by my early connection and continued with Pankey Institute, in which, very, very different from anything else, in that we truly believe that it's comprehensive care, patient relationships, etc. Now, that audience has decreased naturally. And so we always feel that we're behind medicine by 5 to 10 years. Were there any physicians 30 years ago that said, I'll never join a hospital group? And yet the only physicians that haven't are those that are concierge physicians. So I
Mm.
believe there's always going to be 20% of practitioners who will be fee for service. You just have to depend upon if you're one of those. Now, there's something else that's happened, generations. And I do a course on generations in dentistry. In other words, our patients looking at their generations and us looking at our generations.
Mm.
And in defense of dentistry, years ago, we didn't have HIPAA. We didn't have OSHA. We
Mhm.
didn't have workman's comp. We didn't have 20% off your revenue on a reimbursement. We didn't have all those things. I've always been involved very much in volunteer dentistry.
Oh.
And, you know, I was president of the Florida Dental Association. I was a
Mhm.
trustee to the ADA. I was president of the American Academy of Perio. And I heard my colleagues say, oh, those millennial dentists, they'll go out, test the waters in a group practice. They'll be back. Yeah, in your era, you did that. You went out, tested the waters in group practices, found out you wanted to be more independent, and you came back. That is not the case now. Because I'm still a professor emeritus in a dental school,
Mhm.
and I'm talking to our dental students and our residents. Most of them do not want the responsibility of owning a business. That's a fact. The
Mm.
majority, the majority. And then we'll also talk, you know, and again, there are incredible numbers of female dentists out there who have independent practices and have built practices up from scratch. But as you know, as we move more and more and more now into what, 55, 60% of all dental students are women, you know, men don't have babies, women do.
Mm.
So therefore, it's even more so. Now, I'm not taking anything away now. Anybody listening to this that's a female dentist, I'm not taking anything away from the fact that many of you out there have incredible private practices, including fee-for-service practices. I'm just looking at the demographics.
Mhm.
So the bottom line is, most folks in the millennial generation getting out of dental school, and you know what, we have to talk about debt.
Oh, yes,
I mean,
absolutely.
to ignore debt. And now there are studies out there that demonstrate that debt directs dentists into where they go. And if you ignore that, I think we're incredibly naive. I mean, if
100.
you're $400,000 or $500,000 in debt, do you think a bank is going to lend you money to open a practice?
Absolutely not.
No, no way. And so what are they going to do? They're going to need, and let's face it, I mean, where do pharmacists work? CVS
Walgreens.
and Walgreens.
Yes.
Where do attorneys? I mean, how many
Mm.
independent attorneys are out
Not
there?
many, not many.
I mean, I've got Morgan and Morgan in my backyard. You know, in Orlando, you know, they started in Orlando. Now they're the largest law firm in the country.
Mm-hmm.
So who thinks that we can be something that is not dependent upon the culture, the economy? I'm very much into environmental scans,
Mm-hmm.
knowing that, you know, I'll tell you a challenge. We're going through inflation.
Absolutely.
We got two things going on. COVID, folks thought that now, because they didn't see us for a few months, they don't need to see us now.
Yeah, right?
So
That's
now
so true.
we've got the highest cancellation no-show rate we've ever had
Oh my God.
because they think they can get away with it because we're McDonald's.
Oh no.
But secondly, when we think about this, if I'm having difficulty putting bread on my table, do you think I'm going to have veneers? We need to reflect back to 2008, 2009.
Oh yeah.
In Florida, the average decrease in revenue was 20%. That's a lot. So in other words, if you had $1 million practice, now you had an $800,000 practice, your overhead's still the same, and you've got a third party taking 20%. So now you're working hard to make $1 million when really you're pulling in you now you're only making 800. You're got 20% taken off the top, so now you're at 600,000, but your overhead has not changed.
Neither has taxes other than going up, right?
And it's I think that we forget about middle America because those are our patients. And we got to provide care for them. But at the same time, I got to pay. I was on a call this morning with a dentist. I said to her, we forget that dentists have anxiety in the fact they own a small business. They look at their team members, you got two people at the front, you got a couple of hygienists, you got two or three dental assistants. You're responsible for their livelihood. And if you ask me what I think I don't think the average American even understands that. I will tell you another thing. I don't think many of our team members understand that we have a business. When I'm talking to a large audience and I ask the hygienists and the dental assistants, what is the percent overhead on a practice? You know what they think it is? 30. They think it's 30%. They don't realize that the Mercedes that we have out there in the parking lot's leased. I mean, they see our home. I mean, we do well, don't get me wrong. What other business, why is private equity so much involved in dentistry right now? I can tell you why. If you own a restaurant, your margin is probably 8, 9% at the best. In dentistry, it's 30. I mean, but the problem is that overhead has continued to increase. So the area that I am looking at, if it's okay to have this conversation.
Absolutely, please do.
As a periodontist, I'm always looking at where is the value added revenue in a dental practice.
Oh.
Value added revenue. In other words, where are the areas that I can be versatile in that I wasn't in before? This also includes DSOs, by the way. Where I can start to move. Because look at dentistry. You go on a website. I do sleep. I do laser. I do whitening. I do conscious sedation. I do everything. But the thing is that really value-added revenue when you stretch yourself out so thin that I'm not saying you're not good at it, but I'll tell you the other part. Do you think we teach marketing in dental school?
Absolutely not.
Are you kidding me?
Yeah. But back to your point on that whole idea of quality control. I mean, like you got to have quality. You can't be doing everything there is to know in that area, in this industry. And then.
So what do we concentrate on? I can tell you what we concentrate on. And again, I left a dental school as an associate dean, so I know what's going on there. But what do we concentrate on? We concentrate on what is the primary thing in a dental school. It's been that way for 100 years. I would like to see it change, but I can tell you what it is. It's restorative dentistry. It's not perio. Perio is something that's back there, on the shelf. Dental students leave most dental schools doing this. They're a glorified dental hygienist. That's what they've learned most about perio. Oh, they know about Porphyromonas gingivalis. Oh, they know about the immunology and the cytokines. But where I want to take this is this. There is something right under our noses. And believe me, this has nothing to do with me drinking Kool-Aid. This has to do with the fact that some folks believe the hygiene operatory is your core.
Oh.
Very different, isn't it?
Yeah, absolutely.
It's your core. It's your core. Why? A dental hygienist sees a patient more face time than any other healthcare provider. Who manages a patient after you've done your therapy?
It should be the dentist.
It's a hygienist. Who does everything in the medical history after the initial medical history? The hygienist.
Oh my God.
Who finds things for you to do?
Definitely the hygienist. Yeah.
Who has very little time to do that? The hygienist. So my focus now and for a while will be dental hygiene workflow. How do I provide time for the dental hygienist? And I'm going to go ahead and say it. Nurse practitioner, physician's assistant. You watch. When physician's assistants and nurse practitioners came out, do you know what physicians said?
What did they say?
Kill them, take no prisoners.
Oh my. Yikes.
Very politically charged.
Oh my God.
They did not want them out there.
Hmm.
And they did everything in their political power to stop it. Let's fast forward to 2024.
Hmm.
How many offices do not have?
I can't think of one.
And also, what are they? Cardiology, gynecology, oncology. Now those nurse practitioner physician's assistants. My point is, it's time to take a very valuable piece of real estate called a dental hygienist and take them out of this modality of just cleaning teeth. That's where I'm going. To do that, there's going to have to be an attitude change. But let me throw something out. You ask about challenges. Let me throw the two most important challenges to the average dentist as we speak and justified by surveys. I'll do three. One, I need quality new patients.
Of course.
Two, I need to decrease my reliance on third-party involvement in my practice.
Ooh. I want to hear you expand on that. Yeah.
Three, I'm desperate for dental hygienists and dental assistants.
Oh, absolutely.
30% of dentists right now are looking for a dental hygienist or dental assistant. 30%. I
Wow.
talk to dentists every day. I say, okay, what's going on? Sam, one of my hygienists left me and I can't find another one. Do you know what that means, Ward? They're seeing 8 patients a day, 4 days a week. That's 32 slots open. What are they going to do? Who's going to do it? I mean, who's going to do it? Even if you built a hygiene school tomorrow, it'd be 4 or 5 years before you could graduate. So here's my point. I don't bring up something unless I got a solution. Keep them on the farm.
Appreciate that.
Keep them there. Keep them there. And there's several ways of doing that. But my way right now, and that's what we're going to dovetail into, is add technology. Add technology at the chair with these new airflow devices that are incredible technology.
Yeah.
Incredible.
Mhm.
That we're not only does it decrease the time by half, but the effect on the microflora and the immune system, everything is positive. But what they take home has got to also instill technology. And what that means is there shouldn't be any manual brushes being sent out with patients anymore. Are you kidding me? I bet you didn't get up this morning and make a phone call on a push button phone.
No.
You used your Android or your iPhone. Why would somebody pick up a manual brush when I've got technology? I mean, look at
Yes.
me. Look
Yeah.
at Unicare. And I will tell you this, flossing is over. These new power flossers, got to remember, I'm going to preface this. I'm a periodontist.
Right.
We know research. We don't just talk about something anecdotally. But these power flossers, I'll give you one like from Philips. These things,
Phillips. I have a Phillips.
the engineering on these power flossers is phenomenal and as effective or more effective than floss. Wouldn't matter, they're not going to use floss anyway. Only 7% of patients floss their teeth every day.
I floss every day, twice, 3 times a day. But I'm definitely going to look into this.
But you're in the business. It's
Yeah.
not, you're not the, that's why I always tell hygienists. They say, oh, I can't believe they don't do it. I said, wait a minute. You're in the business. I'll bet you a mechanic. I just thought of this. I bet an automobile mechanic always gets the oil changed in their car. Right?
Yes.
That's a, I'm gonna have to use that one in Michigan. I'm speaking to the Michigan Dental Association Friday. I'm gonna have to use that. But I'll tell you the other because I'm a periodontist. And that is, how do I get medicaments into periodontal pockets on a daily basis? How do I do that? Because we know that all the brushing, flossing, whatever you do is not going to get there. And that's where we get into technology, to where we develop custom trays for patients that they wear. And you put the medicament in the tray, and these things are technology created to where when you pop it in, the medicament goes into pockets 4, 5, 6 millimeters a day. I mean, what other technology could you have that does that? You couldn't. There's not a device out there that a patient uses that can get a medicament into a pocket. Now, I hope we all understand that we ain't doing this for free. So let me give you a thought. Let's take the trays as an example. Because, right, we're going to talk money, right? I mean, that's your podcast.
Mm-hmm.
I mean, we want to keep people's teeth and keep them healthy. But as Dr. Pankey always said, do what you do best and the money will come. If you take the trays, the lab cost is a couple $100. The patient's cost is $600. Your hygienist is really the one who sold the case. You just made $400. You weren't even in the operatory. Now I can tell you, I'm going to use this as an example. Somebody gave me this example.
That bottom.
You do 2 composites on a patient, 2 class 2 composites on a patient. Let's say 30, 31. It's going to take you 45 minutes to do those 2 composites. Your total fee you're going to charge that patient is about $450. That's not including the cost of the composite and the dental assistant helping you and your time. You know where I'm going with this. Or in the next room, I've got someone doing something that's very important to a periodontal patient. And I'm going to make $400 as a margin. That's exactly the reason. And let's just, I know we're talking, let's just talk among ourselves. Dentists don't make money doing composites. They make money doing crowns. But there's just so many crowns you can do.
That's right.
And once you've done them, you're finished. You know the beauty behind perio? In perio, you're a diabetologist, you're a rheumatologist, you're a cardiologist. Those groups never say to you, you're cured. You always come back because it's a chronic inflammatory disease.
Yes.
Someone will ask me, how long do they have to wear those trays? For the rest of your life. There's no cure. So I'm always thinking about a mission statement in a practice.
Okay.
Number one, there's three. Provide quality care to your patients. And Dr. Pankey said it well, for their teeth, their gums, and their overall health. Now we throw in that third one, don't we? Number two, you must be happy doing it. You, in an ergonomic environment, in a stress-free environment, you need to be mentally and physically well-being in delivering it. Number three, you got to make money. And it's in that order. That is my mantra for every time I go in to do, I do periodontal consulting. I go into general practices and turn them around. But every time I go into those practices, the thing we do is we repeat the mantra. And if you can't repeat the mantra, then we're not going to go to the dance.
Mm.
I can take a practice because here's what we hear. I need to do something about my hygiene business. I just don't know what to do. And that's what we do. We show them how that hygienist now has time to sell your dentistry, develop the relationships with your patients so that they won't leave you, while at the same time financially creating an environment to where dental hygienist working 4 days a week, she should be grossing every bit of $150,000 to $200,000 a year. We have the parameters. Let me give you an example to the audience. 25% of your gross should come out of the hygiene operatory. If it's less than that, you're giving it away. You're doing profies. If it's more than that, and exceedingly more than that, she's outpacing you. That's hard for them to swallow. Because I'll go in and say, oh, Sam, you love us. 40% of our gross is hygiene. I said, no, I don't. That means you're not doing anything.
No,
When
keep
I
it
say it
up.
like that, they say, what are you talking about? I'm saying that if you look at this, they were at 25% 1 year, now they're 30%, now they're 35%, now they're 40%. Where are you? That means they're doing 75%, then 65, you're decreasing in your production. And that's not good because eventually, when she says 60, 70%, that means you're not doing anything. Well, I don't mean not doing anything, but basically.
Yeah. Yeah. So what do you suggest? I mean, would he bring in an associate, or he or she bring in an associate to keep up? If he could,
If you
that
don't have
would be
new
the
patients,
answer.
no. If you don't have new patients, why would you bring in an associate?
Mm.
I mean, what would you do? If you don't have quality new patients, there's another Dr. Pankey saying, like likes like. Now, this is not for everyone in this audience, and I know we're probably going to have a conversation about young dentists and what should they be doing.
Yes, we are.
But I will tell you, when you look at this, if you and I were to start a practice, and one of our focuses was creating wealth, but still doing the right thing for the right patients,
Absolutely.
what generation would you work on? I can tell you, my generation.
The
Baby
baby
boomers
boomers.
born
Yeah.
between 46 and 66. Why? 80% of the entire wealth of this country is held by me.
Mhm.
AARP is probably one of the most powerful lobby groups in Washington. It's a perfect storm. What else? Do you think a 25-year-old person that's been on fluoride since they were born has any decay? No. The most thing you're going to get out of them is what? Whitening and ortho. What else are you going to get out of them? There's nothing else there.
Mm.
We have
Wow.
dentistry that needs to be redone.
Wow.
So if you're going to
Okay.
set up practice, you got two choices.
Hmm.
I can set up near Google. They have good dental insurance. Or I can set up in the Villages in Florida, which is the most high-end retirement center in the United States, possibly the world.
Hmm.
Where would you go? I'm going to the Villages
That's right.
because those folks in Google, oh, they've got families. Do I care? They ain't got nothing in the mouth to do. I mean, if a car, if no car ever broke down, I wouldn't need a mechanic. And that's exactly what has happened in the industry, hasn't it?
Absolutely.
You look at Toyota, you look at Nissan, you look at Lexus. Those are very reliable Honda. Those are very reliable automobiles.
Hmm.
So where are they getting their dollars? It can't be off of repairs. It's got to be in the price of the car. Whereas before, you know where most automobile manufacturers made all their money before Japanese came over?
Parts.
Parts,
Hmm.
parts and repairs, parts and repairs. Nobody wants to talk about it, but that's where they made all their money. So as I use these analogies, to show that, I will tell you, if I were a young practitioner, let's do this. I'm a junior. Let's go back. Let's go in the pipeline. I'm a junior or senior in dental school. What would I be thinking? You need to determine your personality and what you want to do. You need to go to a quiet place and ask yourself. Let me give you some options. I tell you who I am. I don't want to own a business. I don't really care about it from that standpoint of owning a business. I'm okay. I got a family. I'm going to have a family. I want to work 4 days a week, come home.
Hmm.
Hey, where you need to go? To a very, very good DSO. Not all DSOs are created equal.
Right.
You know that. But go to a good DSO, especially one that educates you on the things that you did not get in dental school. And believe me, there are things. Let's say I'm the personality that I actually love what I do. I really want to be with patients. Money, you know what I would do? I would go into public health. I'd
Hmm.
go, I would, first of all, if you do that, especially like on a Native American reservation, whatever, you're going to get, or go into the military. And guess what? You know what you're going to get happen? You're going to get your debt paid off.
Oh, yeah.
You're going to get your debt paid off. I just was in a practice where they're both married, both dentists. She made a decision to take an Army scholarship for 4 years. Guess what? She almost has no debt.
Mm.
What's 4 years out of 35 years of practice? Nothing. So that would be one option. I will tell you another option. Another option is this: become an associate in a really good comprehensive care practice where the dentist eventually wants you to buy in a few years later. And he or she is a quality comprehensive care person that you align with. That's how you will become your independent quality practitioner.
Yeah, I like that.
Now, there are some hybrid DSOs out there, and I love that, to where they allow you to have autonomy. Or you probably have heard this on other people speaking on the podcast. A DSO is not a DSO is not a DSO. It's a big mistake putting them all in one corral. There are DSOs out there that you go to work, you're in a mill. There are DSOs out there that truly, truly care about you. You have autonomy, and you're actually buying in. Those are the ones I like. But if your personality is, well, I'm okay. I don't really care. And I'll be in this practice one day, this practice another day. We're going to move around, then. So the bottom line is there's no right or wrong, is there? There's no right or wrong generation. It's who you are and what you are. But think about it before you jump. That's mine.
Mhm.
I will tell you that I was just in another dental office in Phoenix last week. An incredible practitioner. And we were talking, and he said, as I look at associates, there's one thing missing. And it's not necessarily how well they do with their high-speed handpiece. It's critical thinking, decision making. If there was one area in dental school that we are poor on, actually, you and I could say this is in higher education, right? Folks, we give them rhetoric, which they could get off their phone, but we don't teach them what? How to think and make decisions. People send me cases all the time. So, Sam, what do you want me to do? What do you think I ought to do here? And I say, wait a minute, I'm going to really help you, but can you show me the periodontal charting? What do you need, Dad? What's the radiographs look like? Can you tell me about the patient? What medications are they on?
Mm.
Can you tell me about their dentistry over the last 10 years? Have they seen somebody every 6 months? Or do they see somebody every 5 years? Do they smoke?
Mm.
Are they diabetic? You see, that's what we should be doing. Maybe AI will help us. I doubt it. Because it's still going to be cerebral. So for me, I wish I could give you what is the magic bullet for a young practitioner.
Mm.
The magic bullet is this: decide where you want to be in 5 years. And I'm fine no matter what you do. Now, I will tell you, a dentist came up to me. You can see I do a lot. I'm out there. A dentist came up to me and said, Sam, I have had such a horrible time hiring associates. And this is basically what you hear all the time. I mean, it's like being married. I mean, it's bad. What's going on out there? What should I do? How do I know? Let me give you some characteristics that I've found because my granddaughter is one of these folks. You ever met more people that are like what we call old souls?
Oh, yeah.
Their age has nothing to do with it.
No.
My granddaughter at the age of 5, I could take her to a dental meeting where we were having a dinner, whatever. She'd sit there right there, be a perfect young lady while at the same time be in the conversation.
Mhm.
She's graduating from college from Flagler next in 2 weeks and possibly going to law school.
Congrats on that.
So there are folks that you can pick it up if you're looking. If what we call old souls, they're wise. I'll give you another one. Folks that were in another profession before they went to dental school.
Mm.
They were a chemical engineer. They were microbiologists. I don't care. It doesn't matter to me,
Educators.
but they did something else before they went to dental school. So they're cross-fertilized.
Mm.
Number 3, they're older.
Oh, yeah.
They're older. They're 28, 29, 30. So look at this. Family, older, was in another profession. Look at me. Why did I go into dental school? there was nothing else out there that I thought I wanted to do. What do these people do? They really want to go. They're changing their profession. They're uprooting their family.
Mhm.
They're serious. And then naturally, you get a sense of who basically, what do they think about? What makes them happy? If they see your car and they see that you're at the yacht club, that's the biggest mistake we made. When we wine and dine an associate and their spouse, we take them to the country club, the yacht club. We pick them up in our Mercedes if we have. And what do? They say, you know what they say? I want that.
Mm.
They get home, the spouse says, whoa, we're in the gravy. Now I know what we went to dental school. I want that. What they don't understand is it took me 30 years to get that. And that's the difference. So stability. Now, there is this one, as they say, uh, fly in the ointment.
Mhm.
They do have to have some hands because that is what we do. Because there's a lot of charismatic folks out there that are horrible at the chair.
Oh,
And there are a lot of folks out there that are phenomenal at the chair and can't look you in the eye.
yeah.
You gotta have both.
Yes.
There's not many out there that are like that.
Yeah.
Sorry.
Unfortunately.
Yeah.
Wow, this has been one eye opener after the next. I mean, like completely riveting in your assessment of the industry. I commend you with respect to everything that you've had to experience to even give us what you've given us in these short minutes. Well, almost an hour. It seems like I've been listening to you, and it's just been a
Sorry.
couple of minutes. No, 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 not at all. This has been great.
Well, it's my profession. Why, people ask me, they say, well, why did you spend 20 plus years in nothing but organized dentistry?
Yeah.
Because I care. I care about us. If
So
you're a dentist,
what?
if you're a dentist out there working in a group practice and you don't want to do any more than that, great. I care about you. It doesn't matter to me. The profession matters to me, and that's why I don't like it called the dental profession. In my mind, it's a oral healthcare profession.
Oh,
It's time to change. We are oral physicians.
yeah, yeah.
We're on the cusp of moving into a whole new arena. And I'll give you one. I mean, the one that I love, I love many, many of our dental service organizations, but Pacific Dental, they are so involved in the mouth-body connection. They live it, they breathe it. They have 900 offices, but I was on a call this morning with with the dentist from that group, and I mean, they live, they breathe it. Um, but again, there's many, many of these organizations. But you're going to ask me possibly some closure question or
Yeah, yeah. You've fallen right into where we were going with that. I mean, you basically given us a future look. I mean, looking forward, where are we going? What are we going to do? What are the best plans of practice, action steps that one should be kind of focusing on as they move through this?
there's a reason why we're always in the top five. U.S. News World Report, we're always in the top five professions. There's a reason. Where else can you go 4 years to a professional school outside of college and pretty well the very next month after you got your board scores, make $130,000, $140,000 a year? You can't do that in pharmacy. You can't do that in vet. Eventually, you'll do that in medicine, but it's going to take you another 4 to 6 years. Where else? You know, it's hard to believe that when you're graduating from law school and you're clerking, you're making $60,000, $65,000, $70,000 a year. The average pharmacist makes $80,000 a year. The average vet makes $82,000 a year. Where else could you do that? But every now and then you find someone who is really the star. I'm thinking about, I just spoke at the Arizona dental meeting, and I must tell you, we had a great audience, 500, 600 people, and it was on boomer dentistry. The dental student, you know who introduced me? They had a dental student, 4th-year dental student, introduced me, Asian. He's at Midwestern near Glendale. Very involved in ASDA. You should see, I dress well. He dressed almost as well as I. Shirt and tie, suit, his ASDA pin on his lapel. This guy is a leader. He introduced me. He didn't miss a beat. And I've had a lot of people introduce me. He wasn't. He looked at those 600 people. Clarity, personable, a senior in dental school, Kenny. And when I said, this could be a future president of the American Dental Association. So here's my point. You can tell.
Yeah.
Unless he's really smoking me, I'm going to hire this guy. I'm going to hire this guy. He's got it together.
That is awesome.
And you know what? It's always the 80-20 rule, isn't it?
Yeah.
My book is going to be really thin when I write it. It's the 80-20 rule. It's always the 80-20 rule.
Couple pages, right? That's all you need, right?
Exactly. So I hope this has been
very fruitful, very fruitful, very fruitful. I mean, the harvest is here. I mean, goodness gracious. Thank you so much, Sam, for taking the time and spending with us in the industry. I'm sure people are going to take a bunch of nuggets from this. And I don't know, I mean, you might have enough information to cover a whole month with all of the clips that we're going to be able to snatch from this. This is just great. This is wonderful information.
Well, I know one euphemism, and it is this. The older you get, there's one thing I do know. Everything may be falling apart, but with age comes wisdom. If you're listening.
Yes.
If you're listening. And I've been a listener since I popped out of the womb. You know, I don't know everything, but I do listen to what you say.
Very, 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 very good way to just put a nice little bow on this, because that's what we gotta have some humility as we move through our lives. You know, yeah, you're in a top 5 profession, but still, I mean, like after what, 30 plus years in the business, you still have that ability to listen.
Well, you got to reinvent yourself.
Yes. Yes.
That's the way to reinvent yourself.
Absolutely.
I'm not going to play, you know, we do well. We're in nice clubs, both in Florida and in North Carolina, very nice clubs. I'm not going to go play golf. Are you kidding me? Nothing against all you people out there that are golfers. I'm not going to spend my entire day on a golf course. Now I'm going to play pickleball, but
that's just an hour.
But you know, that's it. I was very involved in racquetball, league racquetball. I loved it. Where else could you go out for 45 minutes, you know, and get that kind of exercise and the competition with it? but I don't know. I don't plan on leaving this profession anytime soon. But I will say this. I was giving this presentation, and I'll end with this, on boomers. A dentist comes up to me at the end of the meeting. I always love this. He's about 76 years old. And here's what he tells me, Ward. He says, okay. He says, Sam, can you help me? And I said, okay. He says, I am 76. I love practicing. I'm healthy. I am in competition bicycle riding. I've done some marathons. Am I too old to be doing this?
Please.
I mean, what was I going to say?
Yes, please.
He says, maybe. I said, look at yourself. And we had a bunch of folks around. I said, look at this guy. Because, they heard him. I said, look at this guy.
Yeah.
What do you think he should do? Do you think he should quit? I said, are you kidding me? There's a phrase, I love this. This is from Jerry Seinfeld. A good comedian knows when to leave the stage.
Mm.
Now, for me, I ask my wife, Tess, a lot. Am I okay? Do I look okay? Am I doing right? Because when it comes to time, I will leave the stage. Warren
Wow.
Buffett.
You're
Warren,
far from leaving the stage right now, my friend.
let me ask you something. Has Warren Buffett left the stage?
Oh no, are you kidding me? He's not leaving the stage. Are you kidding me? Really?
I don't know if you've tuned in to see their shareholders report, that they did a few months ago. Those two guys knew every number on every investment that ever existed.
Yeah, it's strange you should be talking. You mentioned that, and you mentioned how he just comes up with the numbers and lays everything out. I'm currently reading Benjamin Graham's piece, The Intelligent Investor. Woo! Just page after page after page. I mean, like, goodness gracious, this is
There's
great.
no magic bullet.
I'm sorry.
There's no magic
No,
bullet.
no, it isn't.
I mean, the
Right,
book is
exactly.
thin. I mean, you talk to Dave Ramsey on financial, you Susie Orman. You may
Right.
not like what they say.
Yeah.
You hate what they say.
Right.
But
Oh
let's go
my
back to
God.
millennials. Let's go back to millennials. If they
Yeah.
just, I'll tell you real quick. She was
Yeah.
having an interview with somebody, Susie Orman.
Yeah.
They were talking. Oh, I know. It was it was on morning. It was one of the co-hosts on Morning Joe, whatever that is. But it wasn't on that program. They were talking about Starbucks. Okay. I love this. She looks at the host and she says, are you kidding me? You go to Starbucks? She said, yeah, I go every morning. I said, how much it cost you? $5, $6, what have you. So immediately Susie calculated, if you went to Starbucks every day and you multiplied that times 365, and you put that in the market, in 10 years, how much money you would have.
Oh my God.
But the host she didn't retreat. She said, but I love Starbucks. She says, fine. She said, Susie, you don't go to Starbucks? She says, I have never, ever, ever been to Starbucks.
Mm.
She says, I get up in the morning, I go to my cabinet, I open up my Cafe Bustelo. I don't know if you know that coffee, but that's my wife's Cuban.
Okay.
That's what Cubans drink. It's in a yellow red package. And she says, that's my coffee. I don't go to Starbucks.
Mm.
Then she said, I don't go out to eat. Now, Susie Orman probably has a lot of money. But look at them. What does Warren Buffett do? He stops by McDonald's and gets an Egg McMuffin every day. What does he do? He lives in the same house.
Oh, yeah.
I mean, look at him.
He still has the mortgage in
Yeah,
one of his houses.
but look at him. Everyone should read the book, The Millionaire Next Door. I'm
Oh
sure.
yeah.
You know, think about it. What's this? What's the square footage? 1,800. What car do they drive? Something under 40,000. They never buy new. I mean, think about it. But I'm around dental students and dentists. What are they doing? They won a AMG Mercedes. So anyway, you are what you are, right, Ward?
That's right. So
Okay.
true.
We could talk forever, but I know
Yes,
you.
we can. Thank you so
So
much, Sam, again for
you're very,
joining
very
me, man.
welcome. Anything I can do to help you. Really appreciate you giving me a portal that we could get a few words of wisdom out. I really appreciate it.